New York Methodist is the crown jewel of hospitals in the borough of Brooklyn.
It's an exceptional place. I think it's a place that we care for both our patients and our employees.
It's the collegiality in the hospital that is so special.
We have everything here, and we always pay attention to quality for the patient.
It is a great community teaching hospital where the care is delivered in a kind and compassionate manner.
Our staff approach patient care in a very family-oriented fashion. They treat their patients as if they were their own family members, making sure that we meet each and every need. And it's a very warm environment. It's not a sterile environment, which sometimes you find in hospital settings.
The thing that's special about New York Methodist Hospital is the culture of the hospital. Now, this is an old culture. This is the first Methodist hospital in the world. And this theme of people coming together, working in the best interests of the patient while being kind and caring of each other has been maintained, and we have built upon it to what we are now.
We joined the New-York-Presbyterian healthcare system in 1993. We joined for three primary reasons. One, to enhance our image. Two, to have a strong medical school affiliation. And three, to be able to have strength in negotiations with the growing managed care influence.
What's very unique about nursing here at New York Methodist Hospital is that nurses are the first line of defense in keeping our patients safe. The single most important quality that we look for when we hire a registered nurse at New York Methodist Hospital is excellent interpersonal skills. And the reason for that is communication is the key to safety. And as we communicate with our colleagues and with our physicians and our patients, most importantly, and those listening skills, you're able to pick up on cues and clues to see that you can carry that patient through their stay here as safe and with the highest quality care possible.
The emergency department is really the portal of entry to the hospital for a significant number of patients. And we really want the patient's experiences to be excellent when they come through the door, which means we're trying to diminish waiting time, we're trying to perform services at the point of care that generally aren't performed at the point of care. For instance, we have a very highly developed emergency medicine ultrasound team, which will perform ultrasounds of the gallbladder, vasculature, heart, trauma, right at the bedside, so that they don't waste time waiting for tests in the emergency department, and they get to where they need to in a much faster manner.
The Department of Cardiothoracic Surgery at New York Methodist Hospital is one of the finest in the state. And I think it's because we have individualized care. The patients go to one unit and don't have to move. They have minimal nurse-to-patient ratio. It's either 1-to-1 or at most 1-to-4. The complication rate, the problem rate, the disposition of the patients is much better because of that close patient-to-nurse and patient-to-doctor-to-nurse relationships. We're very proud to have procured the Da Vinci robotic system to assist us in minimally invasive and robotic surgery. Since we've had this system in place, we've done over 220 procedures in gynecology, urology, and thoracic surgery. The advantage is that we've had less blood loss, shorter length of stay, less pain, and less complication.
Radiation Oncology Department at New York Methodist Hospital has been a pioneer in really maintaining one of the best cancer centers in New York City as far as radiation therapy is concerned. The Department of Radiation Oncology is equipped with the most comprehensive technological machines, including IMRT, IGRT, rapid arc machines. We have also stereotactic body radiosurgery and high-dose rate brachytherapy. If you are a Brooklyn resident and you happen to have cancer or you need radiation therapy, there is no need to go anywhere but New York Methodist Hospital Radiation Oncology Department.
Here at New York Methodist Hospital, we have the Pulmonary Interventional Division, which specializes in making diagnoses of terminally ill patients, generally those who have advanced lung cancer and who are in significant discomfort because they are having difficulty in breathing, because they may be in significant pain. And rather than subjecting those patients to major surgical procedures, we are able to make small incisions and be able to palliate them, to make a diagnosis, and to improve the quality of their life.
Neurosciences here encompasses neurology, psychiatry, and rehab medicine. When it comes to rehab, we have done some outstanding things. In fact, we're one of the 2 hospitals in the entire state that has a robot which will maintain function and assist patients in improving following loss of mobility, particularly with strokes.
The New York Methodist Birthing Center is a well-needed resource for the community. Parents appreciate that we give them a very good experience. We take care of them and all their needs, and we do it with kindness and capability, and we also deliver very cute babies.
The sleep center is probably the busiest in Brooklyn, and it is open 7 days a week. We are testing the entire spectrum of patients who may have sleep disordered breathing. We also conduct a significant amount of research, and we run an insomnia clinic for our patients.
Our real strength is in our employees and doctors. When I walk around the hospital and I observe the kindness they have in dealing with patients, the high level of care that they give 24 hours a day, 365 days a year, the friendly attitude that they have is so extraordinary in such a complicated and difficult world. That impresses me.